I just want to talk briefly through the data that the mayor pointed out and how that factored into some of our decision-making here in the city. What you'll see is that yellow line, the percent positivity over a 7-day period, so it's a 7-day moving average at each point, has been pretty flat since about May 15th, May 16th. That number, that 7-day average, has hovered between 23 and 24%. You'll also see that line stopped short a few days. The last 3 days, the way that the VDH algorithm works is that it does not include the most recent 3 days just to make sure that data gets complete, because these are posted by date of lab report. And so if we look at the preliminary data, it confirms that the last 3 days have shown somewhere between 23 and 24% positivity as well. And so altogether, that gives us almost a 2-week period of a fairly flat percent positivity trend. That's not ideal. Obviously, we'd love to see that number going down. But remember that this is not the only data point we use. So in addition to the percent positivity trend, we also look at hospitalizations, death rates, and hospital capacity. I think I mentioned to y'all last week that in a conversation late in the week with our senior leadership of our 3 health systems here in town, that there is adequate capacity, that none of our health systems are showing any concerns from a staffing or from a bed availability at this standpoint. Things seem to be in pretty good shape as far as hospital capacity to meet the acute needs of patients if we do indeed see a surge. In addition to all of that, as we start to unpack this data a little more, we've seen that a lot of our disease, a lot of our numbers here in the city are really due to extensive spread in largely Spanish-speaking communities. We've been talking about that over the last couple of weeks. The city data shows that over 30% of our positive cases are in people of Hispanic ethnicity. And so we have really stepped up our efforts and our outreach in those communities in a few different ways. One, we've increased our on-the-ground presence to get good information out with bilingual staff, with community health workers, with other volunteers who are trying to increase our presence, increase trust, and increase knowledge about how to respond to this pandemic. 2, you've heard about the city's efforts to really significantly expand our ability to effectively quarantine and isolate individuals. And so now that program has been built out. We have a screening process in place for our case investigators and our contact tracers who can work through each individual situation and determine whether somebody needs to be housed outside of their current setting to effectively quarantine and isolate. And thirdly, we are really ramping up testing in those areas as well. We're back at Southwood today, and we'll continue being very aggressive about testing all over the city and the county with a particular focus on those neighborhoods with predominantly and uninsured minority residents of our region. I'll say that, obviously these decisions are difficult when we don't see the nice downward trend that we're seeing in other parts of the state, but taken in their entirety and along with the mask mandate and these additional efforts, as the mayor said, a cautious move into phase 1 is the right thing at this point.